Hey, how to plan efficiently for NEET SS Pediatrics in last 15 days. Welcome you all in Pedia Academy by Dr. Pankaj. Myself, Dr. Pankaj, pediatrician by profession and teacher by passion. So today we will discuss the important revision plan or revision strategy in last 15 days. Okay, so the crux is last 15 days are very important. Any student who is able to revise efficiently in last 15 days, chances of rank or marks in the exams are very much high comparable to a student which is not able to revise. Just see what is the crux is to revise whole syllabus in last 15 days at least twice. Yes, you heard it right, at least twice. So you can't revise everything. So what are these hacks and the points to consider in last 15 days to get a good rank? So just deep dive into and understand this amazing thing actually. Okay, so we'll start. Yeah, we'll start. So all we know on how NEET SS exam pattern is. This is actually computer-based test. All we know, 150 questions should be done in 2.5 hours, means approximately 150 hours. 150, approximately 150 minutes. Sorry. So clinical case scenario, image-based questions will be there, and the source again, very much discussion is going on and discussion will always go, but Nelson is the primary major source because all exams through the years, this approximately having 80% share of questions. These questions are, some questions are direct and some questions are indirect questions, but they can be solved from Nelson. So the key to success is conceptual clarity, repeated revision, and practicing MCQs. Next important thing. What are the exam distribution of system wise in these exam? Just see. So this is how we analyzed actually past 3 to 5 years question papers and just try to compile. Okay, but disclaimer is that this list is not perfect because many questions are overlapped. Like any genetic syndrome which has any cardiac association, it may be considered in genetics and cardiology itself. Cystic fibrosis can be considered into GI and respi also. Any neonatology topic can be spread to system or neonatology per se, but this is basic distribution of question. Just go through it. So we are just going through it. Neonatology has 10 to 12% question. Again, this is very subjective. Estimated questions approximately 15 to 18. We'll see high yield topic later, but just see distribution. Cardiology 12 to 15%. Mostly questions are 18 to 22, 20. Again, it is overlapped scenario. Neurology 10 to 12%. The questions approximately 15 to 18%. GI approximately 10%, or you can see 15 questions from GI and hip including. Nephro and Euro has share of around 10%. 12 to 15 questions are from Nephro, but last exam this Nephro part is increasing. Endocrino 7 to 9% questions and approximately 7 to 9%, 10 to 13 questions. Hemat Onco approximately 10%, again 15 question. This is highly subjective. Infectious 10 to 12%, estimated questions are 15 to 18. Respiratory system is 8 to 10% and questions are 12 to 15. Growth, development and nutrition 7 to 9% approximately, estimated questions are 10 to 13. Rheumatology 5 to 7% and estimated questions are 7 to 10. Genetics and dysmorphology is 5 to 7% and estimated questions are 7 to 10. Miscellaneous, you can say it may be 5 to 10, 7 to 10% questions. This is actually, again I'm saying, these are approximate questions. We can get questions outside this and sometimes some exam, some system get revealed. Just go through quickly important topics in this, like neonatology. NRP is important. RDS, sepsis, HIE, sorry, IVH, NEC, and torch infection. Generally, these are important topics. Any other topic can be important, but generally these are important. Okay, so in cardiology, congenital heart disease obviously important. Rheumatic fever, Kawasaki arrhythmias are important. Just broad. In neurology, seizures like febrile seizures, anti-epileptic drugs, mechanism, CP, autism, myopathy, strokes are important. In GI part, neonatal cholestasis, Wilson, IBD, intussusception, GI bleed. Means these are topics you have to master them. You can't leave them. You can read other topics also, but these are very essential. In nephrology, nephrotic syndrome, PSG and HUS, AKI, CKD, pediatric UTIs, endocrino, type 1 diabetes mellitus, DKA, CAH, thyroid is important, short stature, and rickets. Many questions rickets are there around rickets. Hematology, anemia, hemophilia, ALL, lymphoma, Wilms tumor, HLH. Infectious disease, TB, HIV, vaccination, PID, sepsis, respi, pneumonia, bronchiolitis, asthma, cystic fibrosis, ARDS, and growth and development nutrition like milestone, failure to thrive, PM, vitamin deficiencies. This vitamin deficiency is hot topic nowadays. Rheumatology, JIA, SLE, vasculitis, HSE, periodic fever syndrome, Down syndrome, Turner, fragile, feral, Willy, genetic testing, shock, fluid management, pulse, neonatal surgical emergency. So these are bare essential topics. These topics might get added or deleted on the basis of exam pattern. This is overview. Just again giving disclaimer again and again. Just it is overview. Okay, the importance of Nelson tables and images. Everyone know in exams, Nelson table and images are directly asked. Some of the previously asked tables and images from which areas more. In developmental milestone, they are frequently asking same exactly point to point from Nelson tables. Immunization schedule, obviously from NIS and IEP's guidelines. Congenital heart disease charts and their pathophysiology. Neonatal reflexes and growth charts, yes. CSF finding meningitis, just to get overview. And image, X-ray based, clinical picture based, ECG and echo based images are being asked. So this is very important topic. So in our channel, like in Pedia Academy by Dr. Pankaj, we are providing a good set of Nelson based image playlist and Nelson based table and flow chart playlist. These two playlists are in our channel. Just go through these playlists. More images, important images, more tables will be added soon. Okay, so this is just walking revision. Just swipe, don't swipe Instagram right now. Just swipe these reels or shorts, you can say, and you will not miss out any important table or chart. So just revise them whenever you get time, whenever you are in traveling or not doing in class or uh, doing work. Just swipe them and see them. Okay. So this is my crux of my discussion is Nelson tables and important images are very much important and sometimes they have been directly asked. Okay. Okay. So last 15 days, how we should revise. So this is sample schedule. Okay, just go through the schedule. I just made day 1 unitology, like day 9 nephrology, day 13 growth, and day 15 mock test. Just see in this scenario what you have to do. Basically, first, if you see day 1 to 3 neonatology and perinatology, you have to revise very important areas we have discussed earlier, also important topics. Just go and revise them in those topics, okay? Because 80% of questions, the scenario, the 80%, the Pareto principle is, I think it is Pareto principle. 80% are 80% of questions are from 20% of material. So in neonatology, for example, 80% of questions will come from 20% topics. Okay, just go through those 20% topics. Rest 20% questions you will handle or you can leave. Similarly, for every system, it is true. So go for most important topics in this last 15 days. Just revise these system accordingly, as I have mentioned, or you can make your own custom plan, but it should be aligned with the time duration. Okay, and don't go like I will do neuro for 5 days. You can't do. Just do important topic of that system. Okay, how you will do? So again, we as a Pedia Academy by Dr. Pankaj, we are giving solution to this. Okay, we are revising every system in one day. Like it will be approximately 2 hours or 2.5 hours of lectures of each system. What we will do in this, we'll just compile all important topics in, including previous year's asked topics in NEET SS Pediatric and potential topics also in the short frame of time. And what we'll do, we'll try to revise them important points in these topics. Okay, so if you are new or you are revising, so you will be able to revise the important concepts and topics which are very important and very vital for exam. So we're starting this series of playlist of each revision, fast revision topics. We are calling it fast track pediatric revision series. So we'll be starting this series soon, and you will get a fair idea of each system and important topics for that particular part. We'll do this and follow us, and you not regret it. Okay. So, 48-hour revision plan, is this entity exist? Yes. Last 1 or 2 days of exam, before exam are very important. You should plan your travel accordingly, and because centers are far away, I heard of, and just plan 48 hours very smartly, like mnemonics, flashcards, mock test reviews, vehicle reinforcement, pediatric emergency algorithm, NRP, and PALS. You can do one-page summaries, vaccine schedules, and revised notes. This is basically the traditional teaching. You should revise one-page notes. But from my side, what I'll do for you guys, I will do 11th hour revision. What it will be? It will be when you're traveling to your test city, test center. Okay, I will give you a kind of video, or it might be audio file. Okay, so you will revise all the important topics once again in just one go. You don't have to see the video. I'll give you the audio version of the revision. So I'll be calling it 11-hour revision plan. So it will be like your last push. So I'll do this effectively after revision videos. Okay, so these are generally exam tips. Generally, these are ignored, but these are very important. So, reach early, carry admit card. No last minute cramming, just don't cram in last minute. Stay hydrated and eat light. During exam, 50 questions for 50 minutes. Generally, we know because 1 minute per question is allowed. Read the question twice, yes, and use elimination by tricking MCQs, flag doubtful question, revise later, and obviously for after exam, do not over-analyze. So this is very important, generally ignored by generally ignored by doctors, exam going doctors, and leads to anxiety, panic, and they can't give full performance. So just be relaxed, be calm. From my side, again, I'm giving you the important revision plan, which is fast track revision of pediatric NEET SS. So do share, like, subscribe our channel. This is starting of this channel basically. We'll do many things post exams also. Very interesting things are in pipeline. We are in collaboration with some good team, and we'll do many things, interesting things, because pediatric is truly my love. Obviously, it's your love also. So stay tuned. We'll meet in another video. Hopefully it will release soon. So stay tuned and do like, share, and subscribe.